It's a real kind of, it's like a walk-in, walk-out procedure.
Wow.
It's in an hour.
How did you treat it? What did they do?
It's called pelvic vein embolization. They basically use platinum coils. Got platinum in my body now. And they use these coils that wrap around the veins and they stop the veins from working.
But all those years you could have been pain-free.
Yeah. This is the thing. And the GPs don't know enough about it. We need like increased investment in research. We need better access to specialised services. And we just need a greater focus on women's health issues.
Pelvic congestion syndrome can present as multitude of different symptoms that overlap with so many different diagnoses. But if someone's got chronic pelvic pain, we must be considering this diagnosis. I did a video about this a long time ago, but now I'm refreshing this because Kate Lawler has obviously talking about her experience, and I'm so glad she has. But sadly, there are still doctors out there and clinicians out there who even believe that the condition doesn't exist. But if you're thinking of the diagnosis as a GP, there are ways to pick it up. The first way is examination. So examine the abdomen and also the vulval-vaginal area. It might be possible to see varicose veins on the vulva, and they might extend down into the inner thighs. You might also notice abdominal tenderness on either both sides or one side when you're examining. The other thing is to get an ultrasound scan. This can help detect abnormal veins and show how blood flows through them. Finally, other scans like getting an MRI or a CT scan might be needed. A pelvic venogram can also be used, and this can help plan the correct type of treatment. It's a more invasive test, but it's a simple and safe procedure. It's done by injecting dye or contrast that can be seen on X-ray machine through a small tube placed in the vein in the groin or the neck using local anesthetic. The contrast can then be injected and the images can be seen on an X-ray machine, giving a picture of the veins and what they look like. Treatment options can vary from patient to patient. You can have the hormonal contraceptive pill. This might help with the hormonal issues that could be interlinking with the pelvic congestion syndrome. Also using amitriptyline, which is a medication that is an antidepressant but at low doses can work great as a nerve painkiller. Pelvic vein embolizations, this is when metallic coils are placed in the abnormal veins to block them. Sometimes this is in combination with foam that helps to block it further. Following the procedure, recurrence rates are reported to be less than 8%, so a huge improvement in symptoms within the first 2 weeks, between 70 to 85%. Finally, laparoscopic surgery to tie the affected veins can also work, but that has its own risks and benefits. There are probably many people with pelvic congestion syndrome who don't even know it, so if you're struggling with abdominal pain that doesn't seem to